Let's give a warm welcome to our guest today, Mr. Scott Osiecki from the ADAMHS Board.
And I know we talk about drugs, but people becoming addicted to alcohol, we still can't forget about that as well, because that still is an issue in our community. And what that would be, it's sort of like, we call it a living room model, where an individual could just walk in and say that they're experiencing these issues. They need to talk to someone. Some people could drink casually, right? Where others become addicted to it.
Motivation for growth, 2 toes down, he keep it realer than most. He do it for the culture, that's always the goal. This is Strategic Moves with Ken Dow. This is Strategic Moves with Ken Dow.
Hey, welcome to another episode of Strategic Moves. I'm your host, Ken Dow, where we dive into the pressing issues of our time. With some of the most influential people in our community. And today we're fortunate to have Scott Osiecki. He is the CEO of the ADAMHS Board here in Cuyahoga County, Ohio. For people who don't know, that's Cuyahoga County, Ohio. He is the CEO of our ADAMHS Board, and he's going to tell us what all of that means in a second. And he's come on to our station today, and we're going to talk a little bit about what's going on with drug addiction, mental health, and some of the other services that they offer there at the ADAMHS Board. But before we get started on that, I want to give a shout out to our best podcast producer in podcast history. I gave him a title, Scott, as best podcast producer and podcast history. That's a big one to live up to. Yep. What's happening, Latif?
Wow, thank you, Ken. I appreciate that.
Yeah, see, giving you your flowers. That's what that's called.
I appreciate my flowers.
Giving you your flowers. So what's going on before we jump in here with Scott?
Well, you know, we got a busy day today. After this, we got our press conference, so.
Oh, yeah, that's right. We're doing a press conference today. We're having a press conference where we're part of an organization that is attempting to put 1,000 men on the street on September 28th to do canvassing in the city of Cleveland and knock on doors and try to get people out to vote. So we're going to be part of that kickoff today, and that's what Latif is talking about. So anything else, man? We're going to get started with Scott so we can get moving.
Let's jump right in.
So let's jump right in, all right? Hey, Scott, so we want everybody who don't know and everybody in the audience here today, we want to welcome Mr. Scott Osiecki to our program.
Yes, thank you for having me on. I'm very honored to be here.
Oh, not a problem. The chief is a little late with your audience, Scott, but we got you there.
You said that so soft that I was like, wait, okay.
All right, let's do it again. So everybody in our studio audience, let's give a warm welcome to our guest today, Mr. Scott Osiecki from the ADAMHS Board.
Thank you very much, Ken. It's a pleasure being here.
Oh, yeah, that's much better. That's right. We like that. We like that. That's the benefit about recording, because we can record.
Oh, that's perfect. That's good.
So, Scott, let's start off with your journey. Before we begin as CEO as the ADAMHS Board, you had a diverse background in social services and healthcare. What experience from your past role shaped you for the approach for managing the mental health and addiction services at Cuyahoga County?
Yeah, thanks for asking that. So, like you said, I've always been involved in nonprofit and helping individuals. I worked for the Hunger Network of Greater Cleveland, which is right here in your building as well, when I was the Hunger Task Force, and that's where I learned, I met Reverend Golston, so we know each other for about 30 years as well. So I always wanted to be in a business that was helping individuals rather than making money for somebody. So, and also in the various things, I worked for CMHA as well, and working with former CEO, Mr. Denahan, was really a great learning moment for me the entire time working with him. So I learned a lot to be CEO from Mr. Denahan, as well as, you know, he was a great advocate as well for the people, and that's what I also want to be the same way.
So, Scott, I want you to talk to the audience and tell everybody what does the ADAMHS Board does and the initial ADAMHS Board and all of that. What? Because I have millions and millions of listeners who watch this program, and everybody's not from Cuyahoga County.
Yes.
So for the people that's listening, what is the ADAMHS Board?
Yeah, so ADAMHS stands for Alcohol, Drug Addiction, and Mental Health Services Board of Cuyahoga County.
Okay.
Actually, we're one of 50 boards throughout the state of Ohio,
Okay.
and we're a quasi-independent part of county and state government. We receive our funding mostly from the Health and Human Services levy, so thanks to all your listeners for passing that. We are governed by a volunteer board of directors. We have 18 slotted, and I believe we have 16 right now. What we do is we are responsible for the planning, the funding, and the monitoring of all the community mental health and addiction services within Cuyahoga County.
You know, that's where I think we very first met. I wonder, when I was thinking, because you was mentioning you was at Cuyahoga, I wonder, was you there when we first met? Because we started working on the Health and Human Service levy together.
Yes.
But was you with the county? I mean, was you there, or you were somewhere else before?
But been at the ADAMHS Board for about 30 years.
So you was with the ADAMHS Board even then?
During the health.
Yes.
Yes.
And I remember you were notorious for those things because you kept running all the phone banks and everything. You kept everything going. Yeah.
But now with technology and everything
they don't
like
even
that,
do that anymore.
They said it's not that productive anymore to do phone banks. So
and that's been a while. So we've been doing the Human Service Levy for quite a while. At least I didn't do it the last time with you guys, but I've been working with you guys on that quite a while. So and you still at it, I see, huh?
We're still at it. Yeah.
Excellent.
Yeah. So we're really grateful for the taxpayers, in Cuyahoga County for allowing us to have the funding to do the work that we do.
Digital C made significant strides in expanding broadband access in Cleveland. How does the improvement of digital access play a role in addressing mental health and addiction issue? And can you discuss any collaboration between you, Digital C, and the ADAMHS Board?
Yeah, so more people who have access to the internet, right? It's great. They could find information about mental illness and addictions. They could visit our website, which is ADAMHSCC.org, and we even have screenings on there. So individuals could take their screenings, they answer questions and see if you're exhibiting signs or symptoms of mental illness or addiction. And then it could follow up that you could take that to your doctor to talk about any issues. It's not a diagnosis or anything like that, but it's letting folks know. Also, with the pandemic, a lot of our providers, went to over. Oh, that light just don't like me.
No, we're going to leave that one off today because we got the blue light. We're going to roll with that.
Okay.
Go ahead.
Yeah, that they could be able to have their counseling sessions via Zoom or via Teams or things like that too. So it's really opened up. Oh, I just also want to say, Ken, too, that the ADAMHS Board, we don't provide direct service, but what we do is we contract with about 72, 75 provider agencies to provide those services for us.
So let's talk about that a little bit. So you're saying you don't provide the actual services there. You guys provide services to organizations that provide. What kind of services you provide to them?
Yeah, so we fund them. That's one of the major things. We also have oversight of the agency, so they give us various reports that we follow, and we are just kind of oversight of those agencies.
So you help them with some of their funding needs they need and kind of oversight some of the things that they got going there.
And they're partners with us, like on the Health and Human Service Levy or other campaigns and things that we do.
Let's see. Cuyahoga County faces a range of challenges from addiction crisis to mental health services shortages. And what do you see as the biggest obstacle currently threatening the well-being of residents, and how does the ADAMHS Board address these issues?
Yes, so actually there could be two, Ken. The first thing is that a workforce shortage. So just like after the pandemic, a lot of other industries have shortage of workforce. It is certainly affecting the behavioral health community. It's a hard job, right, for individuals to be involved in mental health and addiction, and sometimes they get burned out, right? And then also the pay has never kept up scale with the rest of the health industry. So the ADAMHS Board, we're working on that. The state of Ohio is working on that as well to bring more people to the field and even welcoming people back to the field. The other thing that's really harming our community right now is fentanyl being in various street drugs. So the way the ADAMHS Board is handling this is we offer fentanyl test strips. We have Narcan available out in the community. We even have some vending machines out as well, but free access to these things. And the ADAMHS Board, we don't condone any sort of illicit drug use, but we want people to know what they're taking. We want people to make an informed decision, and then so they could be alive to get help if they need it. But what we're finding is that, right, the fentanyl is in the street drugs. People don't know what they're taking, right? So things may look like a pressed pill, and it really isn't. It's a fake, a counterfeit pill that has fentanyl in it. So that's why we want the community to know that they could test that to see what they're taking and to make informed decisions.
Are people receptive to the vending machines? I find that, and working, so I won't put out there. I told you we're working on something. We're finding that the vending machines, we're getting some pushback from people. They're not wanting to have those type of machines around.
Well, that's also like dealing with stigma, right? That could be another issue that we're facing. You know, since the pandemic, stigma has lessened with mental health issues, but addiction issues are still, you know, people are embarrassed about them, or people think it's a lack of character or something, but it's not, right? It's an actual physical disease that people have, that they're addicted to things. And then some people think having that out in the community in the open, it's promoting drug use, but it's really not.
Right.
Harm reduction is the best effort that we have to stop overdoses, or at least curb overdose deaths.
Well, what are some of the communities, why I have you on, that you see that's largely being affected by the fentanyl areas? What zip codes or areas you would say?
Yeah, so actually we're finding now that more overdoses are happening in the African American or the Black community.
Really?
And yes, and that's when, if they're taking street drugs, you know, they're not intending to take that, and that's how the overdoses are happening with the fentanyl that is in there, and unfortunately deaths as well. So actually what we do is we work with the medical examiner's office, and then we find out where there's pockets of deaths happening, and then we could able to target those areas with media promotions, direct emails, direct things like that, to get the information out into the community.
And how are they taking the fentanyl, well, mainly?
Yeah. Oh, it could be in cocaine. It could be in meth. It could be in pressed pills like Adderall. You know, so let's say college kids or teenagers or whatever are looking for Adderall, so, you know, to kind of keep going. But then they find out by overdosing, or, you know, or some, you know, they'd be saved, but overdosing, that there was actually fentanyl in those pills. You
know, because it's strange, Scott. It's like that African Americans traditionally, and when I hear fentanyl, that's why I said that I know that there's opiates, which is pills, and when I think of it, I'm thinking of people taking pills, and that was mainly affecting the white community more so than the African American or the Black community, you would say. Correct. And now with this thing of fentanyl, you're seeing more in the African American community.
Yes.
Really?
Yes.
That's deep. So they and it's not because they're taking it more in an opiate form or a pill. Not. They're shooting it or whatever they doing, whatever they are to get. Right. That's interesting.
And it's in there, and they don't know. You know, they're not looking for the opiate.
Interesting. Now, how about the opiate? I know it was a big issue and a big thing, the opiate crisis. So how did that shape out? So did it balance back out more over on that side, and now we're more
we're moving to the other side? Well, we're finding it's just continually morphing, right? So I remember it originally started with doctors overprescribing pills and people becoming addicted, and then they would stop them. Then they were looking for street heroin, right? They were looking for that. But now the medical examiner would tell you it's not really heroin that people are dying of, it's the fentanyl. So it just keeps continuing to morph.
What's funny about it is that, you know, Black people don't make fentanyl. How is this fentanyl? I mean, where I know you is everybody says, well, how is it that it's predominantly in one area like that when it's like not? Isn't that a chemical drug? Like, isn't it? It has to be manufacturally made somewhere, right?
Right. It's manufactured outside of our country. Wow. And then it comes in. I don't know all the drug enforcement agency stuff, but it is. It's manufactured outside. They come in. It gets into the street supplies, and you know, when the DEA finds them and they cut it off, there's just another route coming right back in.
Is there any correlation to that in poverty, drugs? Well, and you would say that that's why African American community is more faced with it because of that?
Yeah. So you know, fine with addictions of how people start, right? They're looking to to escape certain things. Maybe they've suffered trauma, right? And some people, it doesn't matter. It might just be the first drink or the first pill they took because they are chemically dependent on that when it reaches their brain. But you know that mental illness and addictions really don't discriminate against anybody, whether you're rich or poor, black or white. It's just it's a universal. It's just that now the drugs, right, they're putting that in the street drugs that would be typically used. You know, in let's say poor neighborhoods or not either. So,
my phone.
Your
Jesus.
phone.
I don't worry about it. Let me cut this off. Okay. Cut that off. Oh, go ahead, Scott. I want you to continue. You was on a good point.
Oh yeah. So you know, people are often looking for a way out of certain situations in their life. So, but it really does affect everyone.
You know, what's really when we were talking about, you know, the use and bringing it into the country and folks who are actually involved in that, have there been any kind of studies that kind of show that mental health, and I would like to believe a person with mental health issue and dealing with drugs has to be a bad cocktail.
Yeah. So
and is there studies that show that that in our black communities, especially, that there are higher usage because of mental health issues that are affecting them? And is that a thing? Because now I was going to ask you, with the, you know, the mental health thing being a thing that's more out in the public and people are more talking about it, which means that people are getting more help about it or getting more assistance with it. Are you finding that the mental health portion of your business is seeming to be going up and we're dealing with a lot more mental health versus the drug addiction, or is the same?
Or the same, yeah.
I can't get my phone to cut off. Let me trigger out.
Okay.
Go ahead, Scott. You can go ahead.
So we know that with more awareness of mental health issues, people are more comfortable now to seek out help for that.
Okay.
And we often find comorbidity issues, right? So a person with mental illness could also have an addiction issue. And it's once again because a person with a mental illness might be self-medicating themselves.
Okay.
Let's say that they're
That's
depressed
correct.
or they're anxious, that they're looking for a way not to feel that way. So that's how sometimes they get addicted, you know, to alcohol as well. And I know we talk about drugs, but people becoming addicted to alcohol, we still can't forget about that as well, because that still is an issue in our community.
Cuyahoga County Diversion Center has been a significant part of your strategy. Can you explain the role in providing alternative approach to handling individuals in crisis, and what are some of the successes and setbacks of encountering in this initiative over there?
Yeah, so the Diversion Center was originally started as a way for law enforcement when they came across a low-level, nonviolent offense and they were suspected of a person had a mental illness or an addiction issue, that they would be able to call. We have a hotline set up, 623-6888, and they would be able to have a brief screening to see if the individual was eligible for the Diversion Center. At that point, then they would be able to call the Diversion Center. You know, Frontline actually was answering those phone calls for us, and they still are, and they would be able to instruct the police officer to take them there. So one thing that's important to remember, that this Diversion Center is voluntary. So a person cannot not agree to go, would not agree to go, or once they get there, they could leave as well. So then we found out that police officers weren't coming across a lot of low-level nonviolent offenses who would fit it, but they said they know individuals in the community who could benefit from mental health and addiction services. So we opened the referrals to that, as well as fire and EMS as well. And then when we were going through and analyzing how the Diversion Center was working, we opened it to friends, family, and self-referral as well. So an individual, still family, friend, or whatever, it's still all voluntary, and they have to call that 623-688 number to get pre-screened. So
what happens when you go there?
Yeah, so when you go there, you receive an evaluation and assessment. The individuals there would be able to see what services that you do need. If you need detox services, that's available right there at the Diversion Center. If you need counseling services, that's available there, and residential treatment as well. So that would be, let's say it was medication management, you know, getting somebody maybe with mental illness who aren't using their medications anymore to get that. yeah, medication assisted treatment is also when a person, you could help medications to help them with their addiction. So people could stay 5, sometimes up to 9 days, depending on their each unique situation. And then they get a warm handoff or a referral to further treatment services, outpatient treatment.
So they stay up to 5 days. Then.
Yeah, that's the average that we have.
And now it's open, like you say, to family. So if you had a family member you think who can use some help or something like that, they can call, what, 611?
623-6888.
623-6888.
Which is actually 988. So if I could take a minute to talk about that too.
Okay,
so
good.
988 is the national hotline for mental health and addiction issues. And we're lucky here in Cuyahoga County that Frontline, which always has been operating our crisis hotline, is 988. So you could call 988 or 623-6888.
When should you call that number?
We call it a when or what?
Yeah. My question is, if you was a person, when should you call that number?
Yeah.
Scott?
So let's say, first of all, that you are looking for information on mental and addiction. You could call that number. Let's say you're looking for a referral. Let's say I know that I need mental health services or addiction treatment. You call that number and they will give you a referral to where you could go. And also then it's the crisis hotline. So if an individual is feeling suicidal, that they need to call that number. We want you to call that number and then they will get you the help that you need.
So if you're really feeling suicidal, you're not feeling it, that's a place that you can't call and somebody will answer the phone and talk to you.
Oh, yes. They'll answer the phone. They'll talk to you and then they'll make a plan or whatever. Sometimes they may even come out to where you're at to make sure you're okay, or with your permission, call a family member or maybe law enforcement to interfere. Not interfere. I didn't mean that word. Intercede. I'm sorry. And, to make sure that the individual is okay.
Is that 24 hours, 7 days?
24/7. Yes.
Really?
And the Diversion Center is 24/7 as well.
The Diversion Center was getting some slack by some of the folks because they said, there's never nobody in the Diversion Center. It's always empty. And the police wasn't bringing people through there because the police was complaining at the fact that, when we go get somebody, we don't want them to go in the front door, go out the back door and right back over there again. And now you're calling us again because he done came back.
Yes.
So that had to be a issue. How are you guys working through that process?
Yeah, so we've heard from police officers, the same thing, as well as we hear for them to take an individual down there. They have to travel from wherever they are in Cuyahoga County, and usually 2 police officers have to go on that sort of trip. So then they're saying that the police officers, it's taking time away from their other duties or being on the streets in their community. What we do is we are working with police officers. We have crisis intervention team training. We have 2 specific officers that are funded through the county, through the Diversion Center grant. And they specifically do CIT training. They also go to roll calls, police, morning, noon, and night. They go to specifically talk about the Diversion Center. So, and then also we're constantly working with the county and Oriana House, which operates the Diversion Center. How can we tackle these issues? So of course we would like police using it more, but the fact is people are still using it. There were 4,000 people since it opened up, over 4,000 people who've had contact with the Diversion Center, and over 2,000 that have completed the program there.
That's really good. That's getting a good number. And is it just for Cleveland or the whole county?
Yeah, it's all of Cuyahoga County. But the diversion board, there's a separate diversion board that was created by the county. And what they recently did is change one of our admission criteria, that if an individual lives out of the county, but they have a court case in Cuyahoga County, the court can make a referral for that person as well as a county resident.
Interesting. With the recent focus on mental health and substance abuse in local media, how does the ADAMHS Board assure the community maintains a well-informed and engaged with available services?
Yeah, so like I said, we contract with over 70 to 75 provider agencies. We do a lot of advertising to let people know. Specifically now we've been focusing on 988 to let individuals know that. We have various community involvement. We're involved in a lot of different boards or commissions or community groups. So we want to make sure we hear from the from the community as well. And one new initiative that we're starting is care response teams. And that's in zip codes 44102 and 44105. And what that is, that an individual in those areas, we're starting a pilot program. So we're just starting with those 2 zip codes, which are identified by the city of Cleveland as one of the areas that have, most interactions for mental health and addiction. And it's a non-police response. So what it is a behavioral health specialist along with a peer. So a certified peer, actually. So it's an individual who's living in recovery from mental health and addiction, and they know where the person is and how they're feeling. So when they'll call, they'll actually go out to the community, and we're going to do that 24/7. We're hopefully to start this by the end of September. We've been working on it for quite a while, and it was brought to us by various community groups that this is something that we should really look into. So when it's just another tool in our crisis services that we have that we fund. So, and crisis services are available for everybody in the community. You just call that number, and Frontline will help you out. And Frontline is actually the provider of this service as well.
In your opinion, what is the most effective strategy for improving public perception and reducing stigma around mental health and addiction issues? How does your team work to the most typical and most approachable or less taboo? Give me some examples of some of the ones that are less taboo.
So some of the things that we do are grassroots outreach, right? And we also reach out. We have a faith-based committee, and we have faith-based providers as well. And we are reaching out to the faith-based community to make sure that individuals, know how to react when someone comes to talk about a mental health or an addiction issue. I forgot the rest of your question. How we reach out to the community, right? So, and the best advice we give is people to talk about it, right? Don't be ashamed. You wouldn't be ashamed going for a broken leg, or you wouldn't be ashamed for diabetes or cancer anymore, right?
That's correct.
You wouldn't be embarrassed about that. And you need to tell folks about it, and you need to let people know that help is available, and we know that treatment works and people do recover.
You're one of the few boards that does have a faith-based component. I remember when you said that, I thought about it. I came to a couple of events you guys had with them down there. And you guys are one of the few that does continue to reach out to those guys.
Yeah, and we're continuing to reach out. We're going to have a series on trauma that we are working on.
Excellent. Scott, you've been one of the key players in shaping mental health and addiction services in Cuyahoga County. Do you have any personal experience or insights that influence your leadership and decision?
Right. So the reason why I'm in this business and so dedicated to it, alcoholism has affected my family. So I know the results of that and what could happen to people's lives. And also suicide has been in our family as well. So it's important topics, and I want people to know, right, that help is available, and don't be ashamed to talk about it. We want everybody to live in recovery the best possible life that they had. So, over the 30 years that I've been there, and 6 as the chief executive officer, I always try to make the decisions on clients and family members, what is best for them. And our board does the same thing, of course.
Well, I'm looking ahead. What are some of the long-term goals for the ADAMHS board? Are you and any upcoming projects other than one you just mentioned that you thought that you want to talk about? So
the care response teams, right? Once we're going to do a year-long pilot on that, and hopefully we will begin to expand that throughout Cuyahoga County. Of course, it's a big undertaking, right? So that we are also working now on the development of a crisis center that would serve as our front door to our system. And we are partnering right now with the centers to do that. And what that would be, it's sort of like, we call it a living room model, where an individual could just walk in and say that they're experiencing these issues. They need to talk to someone. And the individual there would also be a behavioral health specialist along with a certified peer. And then from there, they would be able to triage what this individual needs. So there'll be a crisis stabilization unit there as well as like a 23-hour hold. We would call that, for people who need more intense psychiatric services until they figure, what the best course of action would be. So we're hopefully, actually, we received ARPA funding for this from the state, from capital funding. So we're excited. We're looking forward to that. Probably won't open until sometime in 26. So it's a big project that we're working on.
Scott, if you could, I'm gonna give you a couple of little questions to send you out. These are easy ones for
Okay,
you.
easy. Okay.
Yeah. If you could have dinner with one person,
Mm,
dead or alive, or
mm.
be that person for one day, who would it be?
Yeah, those are always interesting questions, right? Because there's so many people that could be on your list. So I've always been sort of a fan of Walt Disney for what he was be able to create, right? And of how in his imagination it led him to, you know, the Disney empire that it is today, right? And all the different changes too that the industry is making for Disney. So I think I would like to have dinner with him and ask him, you know, how did you have that imagination and the willingness and stuff, and to keep it moving forward?
You know, that's a really good one. I didn't have that question, and nobody said Walt Disney.
Okay.
I'm getting through some good ones, so that's a really good one to put on the list. He's worth talking to.
He's worth talking.
He's still around. They still doing, and it costs a fortune to get in there, and he's still doing his thing. So that's a very good one, I will say, Scott.
Yeah, and right, he didn't let obstacles
get in the way, and his brand lives on, and it's going to live on. I mean, I don't see no stopping it. I mean, even what was that elected official tried to take on Disney?
Oh, yeah, governor,
right? You know, you can't beat Disney.
It's true how they change with the times too, right? Disney, they have, you know, they want to continue on, and
so that's really deep. That's a good answer. Okay. What you say is one of the most common misconceptions about mental health and addiction services that you would like to debunk?
Okay, I would like to debunk that it's a choice, right? And it represents a bad character, because it doesn't, right? Mental illness and addictions are actually biologically based brain diseases, right? Wow. So, you know, there is help available for that, and that's what we want people to know. But it's not a weak character if somebody becomes addicted to something, right? Some people may say, oh, well, they took that first drink or that first pill. Right, but it's a chemical imbalance in their brain, right? Some people could drink casually, right, where others become addicted to it. So really, we have to say, no, this is a disease, and you should not be ashamed of that, and you should seek help for that.
Scott, if it was one thing you wish you could do better, what would it be?
Yeah, there's probably several things, right? The maybe just reaching out more to our community, I guess, as well. You know, sometimes we get bogged down in the administrative functions and things like that at work, but being able to reach out more on a grassroots level, you know, because that's what we've been learning, right? That grassroots is really where you need to be, and we need to listen to our community. You know, we do that, but I think that's something that we could do better.
What's the best compliment anybody ever gave you?
Best compliment, I guess, would be just that I'm doing a good job. You know, I've had great employee reviews, right? For the what they call them from the board. You know, my employment reviews. So I think that's a compliment, hearing from the board. You know, they're doing a good job, and I think it's a compliment also to be able to go out and talk about the mental health board and represent the board.
Excellent. Well, Scott, thank you for sharing your insight and shedding light on the crucial work that's being done to address mental health and addiction in our community. It's clear that your decisions and making a significant difference in what we're doing here in our community, and we appreciate all the work that you're doing. DJ, do you got a question for Mr. Scott before we go?
Yes. Do you see a rise in more mental health issues and more complicated mental health issues that you hadn't seen in the past? And is there any success stories that you could share with us on that?
Yeah, well, we have a lot of success stories. I'll answer that one first, right? So we have something called the Adult Committee Advocating Change, and that is a group of people who've received mental health services or receiving, and they sort of serve as an advisor, right, to the ADAMHS board. They get together, and there's many great stories there of people have went on, you know, to live over their mental illness, right? And lead full and productive lives. You know, mental illness and addictions, they sort of ebb and flow as we go along, but more serious mental illness, the most serious is really like schizophrenia is one of our most serious. And we do see, you know, people doing that. And the thing is too, as long as we keep promoting that there's help available, I think more people will be coming forward to talk about their mental illness.
That's wild, man. That, like you say, mental illness is one that wish on nobody. No, wish on nobody.
Yes.
So, Scott, what we do when we end most of our programs, we give you an opportunity to look right there in this camera.
All right.
This one belongs to you.
Yep.
And you get to tell the people anything you want to end. Let them know how they can reach out to the ADAMHS board, how they can reach out, your web address and everything else. And as always, we will leave links in our description on how you can reach Scott and over there to the ADAMHS board and get help for any other issues or any of your needs that we talked about today. But Scott, camera's yours. Take your time. Say to the people whatever you like to say.
Okay. What I'd like to say is that please remember that help is available. I want people to know that mental illnesses and addictions are a biologically based brain disorder. There's nothing to be ashamed of. If you had cancer, if you had a broken leg, if you had diabetes, you would go to get the help and you would tell people that you were going to get that help. And to reach out to us, our best thing is to call 988. So 988 is our 24-hour information referral, suicide prevention, crisis hotline. And that's really an important number to remember is just 988.
That's really good.
Yeah, and the other last thing is we know that treatment works and people do recover.
Treatment works and people do recover. I think that's what we're going to put on your thumbnail. You just gave me your thumbnail. Treatment work and people do recover. There it is. Scott Osiecki, ADAMHS board here in Cleveland. And thanks for tuning in, and we'll see you next week. Peace.
This is Strategic Moves with Ken Dow.